Hi, everyone, and welcome to episode 110 of the Veterinary Behaviour Chat podcast. So today, I thought we would do a bit of a deep dive on clomipramine. So I did a similar episode on fluoxetine a few weeks ago. And then if you listen to episode 108, you'll have heard me talk also about the SSRI versus TCAs. And yeah, I just thought as probably the most frequently prescribed tricyclic antidepressant, and as we have a licensed veterinary product for this medication, I thought it'd be quite good to do a bit of a deep dive into clomipramine and just kind of, chat a little bit about when it might be used, how it might be used, and so on. Okay, here we go. So first of all, as I just mentioned, clomipramine has a licensed product or a licensed formulation, which is originally Clomicalm. So that many of you will be familiar with Clomicalm. So that was the licensed product for many years. Now I believe there are a few other brand names on the market as well. So here in the UAE, we have Clomav. I believe that is available elsewhere as well. Now in the UK and Europe, clomipramine or Clomicalm is licensed for separation anxiety in dogs. In the US, the terminology goes that Clomicalm has FDA approval for treatment of canine separation anxiety as part of a behavioral management program in dogs greater than 6 months, so a little bit more specific there. And in Australia, it's interesting, Clomicalm is licensed for anxiety disorders and stereotypic behavior, and for cats in urine spraying. So a little bit of a different licensing in Australia. Now, what is the mechanism of action of clomipramine? So clomipramine is a so-called tricyclic antidepressant. So it falls into that sort of group of medications together with other medications such as amitriptyline, imipramine, doxepin, and a few others. But certainly I think from that group, clomipramine is certainly the most commonly used one. Historically, maybe amitriptyline as well, although I think that's not as widely used anymore. And I think that's a good thing because I think amitriptyline has very specific indications. But clomipramine, I think, is still quite commonly prescribed, I would say. So it has two main modes of action. And the first one is basically like an SSRI. So it inhibits the serotonin reuptake by blocking the serotonin transporter. So that just means that the clomipramine that is in the synapse can't be reuptaken into the presynaptic neuron, and therefore we get more serotonin in the synapse. But not only does it inhibit the serotonin reuptake, it also inhibits noradrenaline reuptake by blocking the noradrenaline transporter. So that means both of these neurotransmitters are increased in concentration in the synapse. And this is what makes the TCAs slightly different to the SSRIs. So again, if you listen to episode 108, is the fact that the tricyclic antidepressants have a noradrenergic effect as well as a serotonergic effect. Now, clomipramine, compared to the other tricyclic antidepressants, has a predominantly serotonergic effect, which is probably why we use it as much as we do. But there is also some noradrenergic effect as well. So those are our therapeutic effects. So those are the things that we actually want from the medication. However, the tricyclic antidepressants and clomipramine, they also have a number of different effects on different other receptor types. And that's where we get these numerous side effects that we can see from the tricyclic antidepressants. And that is a little bit also what makes them different from the SSRIs. So clomipramine also has an anticholinergic effect. So it blocks the cholinergic muscarinic receptor. So we get these anticholinergic effects, which in cats in particular can be urinary retention and constipation, which we don't want, can happen in dogs as well. But we can also get dry mouth. We can get glaucoma. So there are a couple of effects that go alongside these anticholinergic or this anticholinergic receptor activity. And also in older pets, we definitely don't want to use anticholinergic medications in older pets because acetylcholine, that neurotransmitter, is really important for cognition, for memory, and for learning. So in older patients where we really want to preserve those things, we probably don't want anything with an anticholinergic side effect. Then clomipramine also blocks the H1 histamine receptor. So we've got an antihistaminic effect as well. And that is most commonly seen in lethargy. So a lot of these patients can be quite flat, certainly in the first instance, or in those first few weeks when we see a lot of side effects potentially from the meds. But it can also cause weight gain. And I have one particular patient, Oreo, where clomipramine really caused massive weight gain. And that was quite shocking to sort of note. And we absolutely controlled her diet and so on. And in the end, we changed off clomipramine from clomipramine to something else because of that weight gain. So that's definitely something to note. Not in every patient, but in some. And that is also seen in human psychiatry as well. Then clomipramine also blocks the alpha-1 adrenergic receptor. So that can cause hypotension and again, sedation. So now already we've got two side effects that might be causing these sedative effects, which is why sometimes the tricyclic antidepressants can be a bit more sedating and a bit more flattening. And then we also have blocking of the voltage-sensitive sodium channels in the heart and in the brain. So there we see potential side effects such as seizures and cardiac side effects, so arrhythmias, potentially even cardiac arrest. So yeah, we want to be really, really careful in patients that have a seizure history or in patients with known heart disease that we probably don't want to use clomipramine or probably any tricyclic antidepressants in these patients. So that's one thing. I think if you're looking for an anxiolytic medication, a long-term anxiolytic medication for an epileptic patient, we definitely are not looking at clomipramine here. We'd be looking at something else. And then clomipramine also blocks other serotonin receptors, so 5-HT2A, 5-HT2C. Now, 5-HT2C, if you listen to the fluoxetine podcast episode, you might remember that the 5-HT2C receptor is this activating receptor that can actually sometimes cause more anxiety and more kind of activation, if you like, as a side effect. Now, in some cases, this is beneficial, especially in human psychiatry, where these medications are used as antidepressants. We want some of that activation, right? We want, we want that the medication is supposed to kind of counteract that depressive effect. We don't really see that so much in our veterinary patients, which is why I think, that activation can sometimes be unwanted or a little bit troubling. And then also the other serotonin receptor that clomipramine acts on is the 5-HT3 receptor, which is a gastrointestinal receptor or a serotonin receptor that causes gastrointestinal signs. So we might see things like vomiting, diarrhea, but also on the other side, we might see reduced appetite and constipation. So we've got the mechanism of action, but then we also need to be really aware of all these other receptor effects that clomipramine can have and the side effects that potentially come from that. So what do we use clomipramine for? And again, if you listen to episode 108, the tricyclic antidepressants and the SSRIs have relatively similar indications for use. And we would use clomipramine in both cats and dogs. For dogs, obviously, because of the license, we would use it for separation anxiety or separation-related fears, panic, phobias, for generalized anxiety disorders, for generalized fear and phobia disorders, but also for abnormal repetitive behaviors, or sometimes also known as compulsive behaviors. So things such as, there are so many of them, and I think there's an episode earlier on in this podcast series where I talk a little bit about abnormal repetitive behaviors, but things such as tail chasing, spinning, fly catching, shadow chasing, acrylic granulomas, maybe pica, maybe psychogenic over grooming or psychogenic alopecia, those sorts of things. So that we use clomipramine for in dogs. And in cats, interestingly, that Australia license for urine marking or urine spraying in cats, so that would be quite a common use, would be for cats that are urine marking, but also anxiety, intercat aggression behaviors, and again, abnormal repetitive behaviors, so such as the overgrooming or true psychogenic alopecia in cats. So yeah, the indication range is quite wide. There are quite a lot of uses for it, and not dissimilar to the SSRIs. Now, when it comes to dosing, this is so important because I actually once had a feline patient, that was receiving a twice-a-day dose, and they did not do well at all. So for cats, clomipramine is a once-a-day dose. And that is because cats metabolize clomipramine differently. So they don't have this hepatic glucuronidation. And that means that we have a much, much slower metabolization. So cats really only need a once-a-day dose. And this one poor feline patient of mine was receiving a twice-a-day dose when I met them and was just flat, totally flat, and rapidly changed when we changed to once a day. In dogs, however, we do use a twice-a-day dosing. Now, the dose range for cats is about 0.25 to 1 milligram per kilogram once daily. And in dogs, it's about 1 to 2 milligrams per kilogram. However, myself and many of my colleagues see the better effects when we go slightly higher in the dose range. So maybe more like 2 to 3 milligrams per kilogram twice daily, maybe even slightly higher than that. And if we're treating compulsive behaviors or abnormal repetitive behaviors or compulsive disorders, we may need an even higher dose. Many still regard clomipramine as the medication of choice in abnormal repetitive behaviors, and we do actually have quite a bit of literature in both dogs and cats on compulsive or abnormal repetitive behaviors and clomipramine. So I think that's definitely a sensible choice if we have a patient with abnormal repetitive behaviors. Now, thinking a little bit about sort of the metabolization. So clomipramine does have an active metabolite, which is desmethylclomipramine, which actually acts much more like an SSRI. And that's probably also why clomipramine has more serotonergic activity potentially than noradrenergic activity. So, you know, we always think of clomipramine when we look at all of our TCAs as being one of the TCAs that's a little bit more serotonergic. And then there's an interesting fun fact about clomipramine, which is that there is a faster rate and higher levels of absorption in dogs that have been fed versus fasted, and potentially greater bioavailability. So we should always be giving clomipramine to dogs that have been fed versus fasted, which I think is quite an interesting fact. What else? So what about side effects? Now, side effects, I've already kind of touched on a few of them due to this sort of the other receptors that clomipramine also acts at. And we've got our lethargy, appetite changes, vomiting, any sort of GI signs. Those would be the most common side effects, I would say, which is quite similar again to the SSRIs. So that lethargy, drowsiness, sleepiness, flatness, and then appetite changes. So reduced appetite, and it could be vomiting, diarrhea, but also constipation. So all of those things are relatively common side effects in clomipramine. But then we've also got these other ones, right, which I touched upon earlier because of these other receptor profiles. So just as another quick reminder, from the histamine receptor blockade, we've got sedation and weight gain. And then we've got the anticholinergic side effects. So the urinary retention, constipation, dry mouth, maybe hypertension and dizziness from alpha-1 receptor blockade. And then that really important thing to consider, seizures, cardiac arrhythmias, and that's from blocking these voltage-sensitive sodium channels. And then another really actually interesting side effect is testicular hypoplasia. So if you've got a breeding animal, if you've got either a dog or a tom, a breeding tom, that is actively being used to breed with, then clomipramine is not the right medication, definitely not. Contraindications is something else we should probably talk about. So there are quite a few. Because of its serotonergic activity, we have to be careful with other serotonergic agents because of serotonin syndrome. Now, there's always this question of how relevant is serotonin syndrome really in a practical sense, but I think it's something we definitely have to have at the back of our minds as soon as we start combining serotonergic agents together. And it might be that we don't see these super extreme signs of serotonin syndrome, right? Which in the worst scenario can lead to seizures and even fatalities. However, we might see some early signs, which could be elevated heart rate, elevated respiratory rate, and these muscle tremors or muscle fasciculations, which can be in the facial area, can be on the extremities, can be on the trunk. And that's something that we can kind of teach our caregivers to look out for. So other serotonergic agents, use with caution. An absolute definite no-no is the combination of clomipramine with a monoamine oxidase inhibitor, such as selegiline. So let's say, for example, you have an older patient on selegiline for cognitive dysfunction. Clomipramine is absolutely not the right thing to combine if that dog is showing additional signs of anxiety. In fact, there are not really any serotonergic agents that can be combined with a monoamine oxidase inhibitor. So we just need to be really cautious here. And we don't want to use tricyclic antidepressants in older patients anyway because of those anticholinergic side effects. Then, of course, as I mentioned, known history of seizures, cardiac disease, glaucoma, again, because of those anticholinergic side effects, urinary retention, anticholinergic side effects. If we have an animal on thyroid medication, we need to be careful with clomipramine because it may interfere with a thyroid med. So that we're talking particularly in dogs here. So if we have dogs that are taking T4 supplementation, we probably don't want to be thinking about clomipramine. And then breeding males, I said, because of that testicular hypoplasia, and the older animals, obviously, because of the anticholinergic side effects. And then I think that's probably about it. What else have I not spoken about yet? So the bioavailability, I think I mentioned, right, is supposedly 25% greater in dogs that have been fed. So that's something that's really important to note. And then the half-life, that's something that we should probably also talk about. So the plasma half-life is about 3 to 5 hours. However, the elimination half-life is a little bit more variable, up to 16 hours. And if dosed daily, so if the dog takes the medication every day, or the cat, if the dog, this is just in dogs, it takes about 4 days to reach a steady state. So there's that, but then don't forget all tricyclic antidepressants take about 4 to 6 weeks to have full anxiolytic effects. So we've got steady state within 4 days, but actually therapeutic effects, that takes 4 to 6 weeks. And if you're interested to learn why that is, then jump into my PSYCHOACTIVE course where I discuss exactly all of the neurotransmitter kind of pathways and timelines, how it is with the SSRIs and the TCAs that you see side effects, and then side effects waning, and then therapeutic effects setting on, and then how that also changes things in the long term, or how the medication works in the long term, which is super, super interesting. Clomipramine is eliminated mostly in the bile in dogs, so up to 80% in the bile, and the rest would be eliminated through the urine. So that's quite a typical, I guess, way of elimination and metabolization. So that's probably, I think those are all kind of the high points, the high pieces of clomipramine. I think it's an interesting one. So I think in a lot of countries, clomipramine fallen out of favor quite a bit. I know in the UK, tricyclic antidepressants generally are not used that much, certainly in specialist circles, even in the US. And look, it might be because we have so much more, I guess, so more cleaner, in inverted commas. This always sounds a bit weird, but less side effects when we're using SSRIs, perhaps. I think it's those side effects, that side effect profile that put a lot of people off using clomipramine and other tricyclic antidepressants. And I think to some of us veterinary behaviorists, the tricyclic antidepressants feel a little bit like outdated, a little bit more, used a few decades ago. And now we have maybe different medications at our disposal that we're using more of. I still think that the tricyclic antidepressants, in particular clomipramine, have really good uses. I actually use clomipramine here quite a bit in the UAE for cats with urine marking. I use both fluoxetine and clomipramine, but they're both equally as effective in my mind. If I'm thinking back to my cases, it's not that cats do so much better on fluoxetine. No, in fact, some cats do better on clomipramine. So that for me is still definitely an area where I would use clomipramine. I guess in dogs, I don't use it as much. I've used it pretty successfully in a couple of separation anxiety cases. I feel sometimes, and this is literally just personal bias, the smaller dogs do quite well on clomipramine. So if you've got a little Chihuahua or another small dog, they do quite well on clomipramine. And abnormal repetitive behaviors, I probably also would reach for clomipramine. It depends on the patient, right? Like, especially when we've got so many potential side effects to think about, and the age and the risk of seizures and the cardiac disease. Sorry, not the risk of seizures, that's wrong. The not wanting to use it in patients with a history of seizures. It's not that using clomipramine causes risk of seizures. That's not correct. But if we have patients that have seizure history, we definitely don't want to use it. So there's quite a lot to consider. I think if I am thinking about clomipramine, I guess my checklist is a little bit longer of like making sure they're not older patients, they're not breeding animals, they're not, there's no history of seizures, there's no history of glaucoma, there's no history of cardiac disease. So there's a lot more to kind of think about. And I wonder whether that might be one of the reasons that it's sort of fallen out of favor a little bit. But I do believe it's a very useful medication. And I know that some of my behavior specialist colleagues who've been boarded for quite a long time, who were boarded perhaps at, in early 2000s or even in the 1990s, they have very good things to say about clomipramine because they used it a lot when they first started, because perhaps we didn't have so many other options. And then I think the other really important thing to think about with clomipramine is that there is a licensed veterinary product for it. And especially if you're working in a country where that's important, such as the UK, where you have to stick to prescription cascades, you definitely want to be thinking about that. If you're using it for any other indication than the indication that it's licensed for in your country of practice, or the species that it's licensed for in your country of practice, you absolutely still need to provide good information to the clients, and you need to get an informed consent statement just to make sure that, the clients have understood that it's being used, yes, perhaps for the species that it's been licensed for, i.e. dogs, but maybe not for the indication. So if you're using it in the UK for abnormal repetitive behaviors or compulsive behaviors, you have to make sure that you let the client know that it's actually only licensed for separation anxiety in the UK. So those are some of the things to think about. It's a great medication, and I just think it's really important with this one that we know all the bits and bobs, right? That we don't want to be getting ourselves into trouble because we've used it on a patient that we maybe shouldn't have used it for. But yeah, I hope that helps. If you want to find out more about clomipramine, then please have a look at my psychoactive course. I talk about pretty much all the psychopharmaceutical agents that we commonly use in veterinary psychopharmacology in this sort of level of detail and more. And I talk a lot more about practical applications, how to start them, decide if this is the right medication, how to stop it if it's not working, how to swap from one to another, and so on and so forth. There's a lot in the course. It's an 11-hour course, so 11 hours of CPD time, and it's RACE approved and it's IAABC approved, and but it's only RACE approved, I think, for 8.5 CE credits, although there's kind of 8 hours of information in there, 11 hours of information in there. And if you are not in the US and you can't apply for race approval, you can get a CPD certificate directly from us if you would like that. So the psychoactive course is definitely one if you want to dive a bit deeper into veterinary psychopharmacology. And then I also have my professional guides ebook, which launched literally just at the beginning of this month, so on the 1st of November 2025. That again has a lot of information about medication choices, choosing the right patient for medications. And it's just a very cool ebook with loads and loads of practical guides and resources and all the things. So yeah, I will put that in the show notes as well. And I hope you enjoyed this episode, and I really look forward to seeing you next week for episode 111. Bye for now.